number of COVID-19 cases continues to rise globally and right here in Guyana. Therefore, we encourage everyone to practice social distancing. Wear a mask if you have to leave your homes and wash your hands thoroughly and frequently as we all strive to stop the spread of the virus. Welcome to InfoHub for Friday, May 22. Thanks for joining us. Data released by the Ministry of Public Health has shown that despite emergency measures, the rate of transmission of the coronavirus continues to climb locally. Delicia Haynes tells us more.
The first cycle of the emergency measures was implemented on April 3 up to May 4, and during that period, 69 being the most of the COVID-19 cases were recorded. The second cycle took effect immediately on May 4, and as of May 16, 23 new cases have been confirmed. As of May 21, 2020, 127 COVID-19 cases have been confirmed locally. Dr. Erteniza Hamilton, Director of Primary Health Care of the Ministry of Public Health, highlighted that the ministry is concerned with growing numbers even as the entire country is under curfew.
You will see from the pattern that the expected results from the measures implemented that persons have not participated fully. Where it was expected that the transmission would have slowed, we are still having new cases every day. Region 1 now has 2 confirmed cases in 2 of their sub-districts. Region 7 has a total of 7 cases. This is not good. My fellow Guyanese, this is the situation that we were working so hard to prevent.
73 of the 127 cases are men, representing 57% of the total number of those infected. Also, of the 10 deaths recorded, 8 of these are men. Here is where Men's Health Coordinator of the Ministry of Public Health, Dr. Dennis Bassier, reached out to men, encouraging them to take their health seriously. He explained to men that there is no shame in wearing a mask and taking heed to the other precautions, as it will not only protect them, but their loved ones too.
It is a general understanding that men have poor health-seeking behavior. This is further emphasized by the current situation. But wait, the plot thickens. Lots of males that have been positively diagnosed are not single. As a result of this, their partners and their children have to be tested due to them being exposed.
The age range of men infected thus far is between 16 to 59 years. This means any man is at risk and should take precautions seriously. He therefore advised that men act responsibly and help their country in stopping the spread of COVID-19. For InfoHub, Delicia Haynes.
The National COVID-19 Task Force, or NCTF, today held a special meeting to consider the applications of various groups of Guyanese stranded overseas as a result of COVID-19 emergency measures and who have requested to return to Guyana. Within the controlled re-entry policy, the NCTF has approved the return of approximately 300 nationals stranded overseas and who have registered with the Ministry of Foreign Affairs via embassies, high commissions, and honorary consuls. This approval encompasses Guyanese nationals in Trinidad and Tobago, in New York, New Jersey, Florida, and other states in the United States of America and from other countries. The applicants or their employers must cover all costs for their return. Entry is permitted by air only. The NCTF reiterates that no person who tests positive for COVID-19 will be permitted entry into Guyana and that all arriving passengers must undergo the PCR tests and submit the results, which must be in English, at least 48 hours prior to their arrival in Guyana. More details can be found on our website and social media. Now for some good news. Residents living in the squatting area aback the number 65 village in East Berbice quarantine finally have access to potable water. This comes after a decade of sourcing their supplies from a nearby canal for daily chores. On Thursday, the Guyana Water Incorporated installed a standpipe in the community. This was made possible through a collaboration between the Office of the Prime Minister's representative in Region 6, Corbin Harbajan, and GWI. After the situation was highlighted 2 weeks ago by the media, the residents were referred to Harbajan, who then approached the utility company for assistance. Harbajan said that once the issue was highlighted, donors have been coming forward. He's already received pledges for a large water tank as well as for individual containers for each home to store water. The approximately 40 families in the area welcomed the installation of the standpipe. The Civil Defense Commission today received $20 million worth of food and hygienic supplies from the Church of Jesus Christ of Latter-day Saints to assist those affected by COVID-19. Here's Neola Damon with that story.
During a simple handing over ceremony held at the CDC's headquarters, Director General Lieutenant Colonel Kester Craig thanked the church for its support during this time.
So the support today, which is mainly for our response to COVID, it's timely and will definitely be given to those people who most need it and most impacted by COVID-19. The process of identification of the most vulnerable has started with a form developed by the Ministry of Social Protection where persons can go online and fill up the form, and the system would identify, based on the information provided, those that are most vulnerable.
Hampers, he noted, will be prepared for distribution following the preparation of a list. The Director General said vouchers for those in need will be sent via mail in keeping with the call for social distancing. President of the Church of Jesus Christ of Latter-day Saints, Wayne Barrow, said that this initiative is an opportunity to extend a helping hand.
Nobody expected, and in project management we call it a black swan. You don't see black swans. And so in essence, COVID-19 is an event that was never planned for, never expected. And in all of my years on this earth, we've never seen anything that compared to this. It has impacted in a very negative manner the economy of the whole world. It has impacted on people, our citizens, in ways that we cannot imagine. And I'm talking about from a psychological standpoint.
The church will be making another $20 million donation worth of medical supplies to assist the frontline workers. The CDC also received a donation of supplies from the School of Nations to assist the senior citizens residing at the Palms Geriatric Home. Neola Damon, InfoHub.
Chairman of the Guyana Elections Commission, Justice retired Claudette Singh, has slammed opposition PPP Commissioner Cees Gunraj over comments he made to the media purporting to speak on behalf of her. Justice Singh said that while she continues to monitor the trends based on the allegations made in the Observer reports, she is of the view that he who asserts must prove. In this regard, when there are considerable deliberations and decisions at the Commission concerning claims of anomalies, the outcome would be officially communicated to the political parties and other stakeholders, particularly the media. The opposition has been downplaying the scores of anomalies emanating from ballot boxes during the ongoing national recount of votes from the March 2, 2020 general and regional elections. The party claims that the government agents involved in the recount are delaying the process by making the numerous objections. Since the start of the recount on May 6, agents have reported that the names of a host of dead and migrated Guyanese have been showing up as having voted in the March 2 polls. More of this story can be read on our website. More news after the break. Stay with us. The following is an important message from the Ministry of Public Health. You can prevent the spread of the COVID-19 virus. If you have the following symptoms: coughing, fever, or difficulty breathing, please stay home. If you don't have these symptoms, then practice social distancing. Avoid crowds. When in a group, keep a distance of at least 3 feet between yourself and other persons. Please wash your hands with soap regularly or use hand sanitizers. The Ministry of Public Health has a hotline to provide information on the coronavirus. Members of the public can call 227-4986 or 624-3067. Welcome back. With COVID-19 posing many challenges, the Project Plant initiative is offering its services to disadvantaged families whilst promoting healthy eating, self-sufficiency and sustainability as part of efforts to contain the spread of the coronavirus. More from Gavin Lewis.
Project Plant was launched on April 17, 2020 by Guyana Premier, the franchise owners of the Miss Earth Guyana organization. Dr. Omish Balmakoon, the managing director for both establishments, shared the background to the project.
Project Plant was in the pipelines for a little while now. As being a part of the Miss Earth Guyana organization, we are always focusing on how to make the world greener and how to get people planting and growing more.
Dr. Balmakoon explained that the implementation of the project was influenced by the Miss Earth Guyana's platform, Beauties for a Cause, which seeks to help vulnerable persons to be self-sufficient by creating their own kitchen gardens and practicing healthier eating during this pandemic.
The aim of Project Plant is to get as many persons as possible planting, helping as many persons as possible to become as sustainable as possible. So you know what's happening during the current pandemic. It may come a time where persons may have it difficult, to source basic necessities. What we're trying to do is to get persons involved in planting their own food, getting their own kitchen garden started, and it's quite simple.
While promoting self-sufficiency and sustainability, Project Plant is also adhering to all safety measures to contain the spread of COVID-19.
It is essential that we keep safe. It is essential that we wear a mask. It's essential that we socially distance ourselves, wash our hands whenever possible. How my team has been keeping safe, that is the rest of Guyana Premier and Miss Earth Guyana organization, when we go out to persons, is that we usually provide the items at a safe distance. We put them there, sanitize, and we leave. Persons just pick up, and after we leave, we are not in close contact with anybody.
Dr. Balmakoon further expressed his appreciation for the partnerships formed and assured persons that Project Plant is here to help. Persons interested in Project Plant can contact Dr. Balmakoon via Facebook at Guyana Premier and Miss Earth Guyana, and also on WhatsApp at 612-0247. For InfoHub, Gavin Lois.
The University of Guyana's Transitional Management Committee, or TMC, is reminding staff and students that no definite date for the return to face-to-face mode of classes has been announced. Staff and students are also being reminded that the only official source of information is the Transitional Management Committee through the internal official sources such as the university's website. A full-scale return to campus before the end of June is not envisaged at this time. However, UG said that updates will be posted regularly regarding the situation next week. Here now is a public service announcement from the Government of Guyana.
The COVID-19 pandemic has had a devastating effect on communities all across Guyana. Many households and individuals now find themselves in need of public assistance. The Government of Guyana will be assisting the most vulnerable. Those eligible to apply for this assistance are as follows. Individuals and/or households who are currently benefiting from public assistance provided by the Ministry of Social Protection. Individuals and/or households who applied for public assistance and are awaiting a response from the Ministry of Social Protection. Individuals and/or households who suffered a loss of income due to COVID-19, and households headed by senior citizens or persons with disabilities. Application forms can be downloaded from the Ministry of Social Protection's website at www.mosp.gov.gy or government.gy/eform/241. For further information, please call these numbers. We are in this together. This is a message from the Government of Guyana. We are here to serve you.
Remember to do your part to ensure that you do not put yourself at risk during this time. If you have a cough, fever, or difficulty breathing, please seek medical care early, but call that hotline first. That's all for today. Connect with us on our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. You can also subscribe to our website, dpi.gov.gy. Your Bridge Report is up next. Have a safe weekend. Goodbye for now.